Hi everyone and welcome to Mighty Kiddos. In today's video we will be discussing what feeding therapy is, who it's best for, and what you can expect as an outcome. And I hope you really find this one helpful and you can learn something new. So join me, guys. Now let's get to it. Feeding therapy is essentially what it says. It's therapy to help children chew and swallow food and be able to accept different textures into their diet. Feeding therapy is done by specialized occupational therapists or specialized speech and language pathologist therapist. Feeding therapy may sometimes include sensory integration activities. It can also include some exercises to strengthen the child's body, like torso and neck and jaw muscles, to be able to carry out the task of feeding. It is really a non-invasive therapy. The first step is that you need to get a referral by your pediatrician. So if you are concerned about your child's diet and eating habits, please talk to your pediatrician first, as you need a referral in most cases. Now let's talk about the red flags that we should be looking for when requesting a feeding evaluation. Now, feeding therapy is most beneficial for kids that have some neurological differences such as sensory processing disorder, autism, cerebral palsy, and even Down syndrome, and children that may have low muscle tone. So these individuals greatly benefit from feeding therapy. Other individuals that can benefit from feeding therapy are those that are having difficulty chewing or moving food around in their mouth and even swallowing. If you have a kiddo that gags or that avoids certain textures or has a very, very limited diet, meaning his diet consists of less than 12 items of food, definitely consider requesting an evaluation for speech. I know sometimes parents are concerned, like, oh, my child is a picky eater. Is this enough to consider feeding therapy? Just being a typical picky eater that doesn't want to eat broccoli, that doesn't want to eat greens, is not enough. We are really looking for extreme picky eaters, as I said. Kiddos that avoid certain colors, that avoid some textures, that have some sensory issues when tasting food. And one thing to keep in mind in terms of feeding therapy is that the results are going to be beneficial. You are going to see results, but you need to be patient. The process does take a long time. I have been told that for a child to try a new food or to even be willing to try a new food, it takes about anywhere from 12 to 32 different exposures to that food. Now, that is a long time, and that is a lot that goes into introducing one single food. So that's just to give you an idea of how slow the process may be. Now, other special candidates that may benefit from feeding therapy are those that are bottle dependent, that are feeding tube dependent, and those that are extremely that gag and choke at the sight of certain food. Those are definite flags that, hey, I need to get my child evaluated. We need speech therapy. So I have now shared with you the essence of feeding therapy. I hope you learned something new, and I hope you feel more equipped to ask proper questions and to look for help if you need it for your child. Now, if there's anything I can clarify for you or find more information, please don't hesitate to leave a comment down below. I really love hearing from you guys, and I'm definitely always looking for ways to help the community that is supporting Mighty Kiddos. So like I said, don't forget to leave a comment down below. And if you like this video or found something helpful, material helpful from here, don't forget to share it with others. The more you share, the more you help Mighty Kiddos grow. Have a wonderful day, everyone. Bye-bye.